Now, in our third section, we will talk about some conditions of chronic laryngitis, in which we will talk about the laryngitis, chronic laryngitis without the hyperplasia, chronic hypertrophic laryngitis, and how these two conditions present, whether it is associated with hypertrophy or not, and how we can treat these conditions and how the examination is performed. So, chronic laryngitis without hyperplasia. It is a diffuse inflammatory condition symmetrically involving the whole larynx through coarse ventricular bands, interarytenoid region, and root of the epiglottis. So it involves the whole larynx equally, and it is diffuse condition. So whole larynx is involved, including the vocal cords. Then we have ventricular bands, interarytenoid region, and the root of the epiglottis. So the whole area is involved diffusely or equally, symmetrically. The causes of laryngitis without hyperplasia. The hyperplasia is increased proliferation of the cells that is not present. So causes are acute. It usually follows as a result of simple acute laryngitis. When acute laryngitis is persists for a long time, it can cause chronic laryngitis without hyperplasia. Chronic infection in paranasal sinuses, teeth, and tonsils can also cause this condition. Occupational factors like exposure to dust and fumes, smoking and alcohol, persistent trauma of coughing, and the vocal abuse. So all these are different conditions that can cause chronic infection or inflammation of the larynx without the hyperplasia. So usually all the acute conditions in the surrounding area can cause this type of chronic laryngitis. Clinical features are pretty much the same. Hoarseness of the voice is present. There is constant hawking. Patient keeps on hawk. Discomfort in the throat. There is cough. Flax of viscid mucus also present. There is hyperemia of laryngeal structure, and the vocal cords are dull red and rounded in shape. So all these are the clinical features associated with chronic laryngitis. Treatment is the eliminate infection, because we noticed that it is as a result of infection of the larynx, which was acute, and also tonsils and paranasal sinuses. So those infections need to be treated to treat this condition. So underlying lower respiratory tract infections should be eliminated. Avoidance of irritating factors like no smoking should be done. Smokers usually have this problem because they have constant irritant that can cause inflammation in the respiratory tract. Voice rest and speech therapy, steam inhalation is very important, and then some expectorants are used to relieve the congestion. Next, chronic hypertrophic laryngitis. Now, this type of laryngitis is caused by the hypertrophy or enlargement of the cells. Hypertrophic laryngitis, either diffuse or localized. Here you can see the hypertrophic laryngitis. It presents as dysphonia plica ventricularis, vocal nodules, vocal polyps, Reinke's edema, and contact ulcer. So all these changes are present in this hypertrophic laryngitis. Because of hypertrophy, there is formation of the polyps, which is the bulge of the mucosal lining, and then there are sometimes nodule formation. There is dysphonia, plica, ventricularis. So these are all the features present in the patients with hypertrophic laryngitis, and that can very easily differentiate from the condition which is without hypertrophy. Etiology is the same as for laryngitis without the hyperplasia. Now the pathology, usually the changes start in the glottic region, which extend to ventricular bands, base of epiglottis and subglottis. Cause mucosa, submucosa, mucous glands are affected, and in the later stage, intrinsic laryngeal muscles and joints are affected. Initially, there is hyperemia, edema, and cellular infiltration in submucosa. Then pseudostratified ciliated epithelium changes to squamous type. Squamous epithelium vocal cord leads to hyperplasia and keratinization. Mucous glands suffer hypertrophy, undergo atrophy with diminished secretion and dryness of the larynx. So all these are different conditions, different changes that occur in hypertrophic type of laryngitis, because there is begin in the glottic region. These changes slowly progress to ventricular bands, to the epiglottis, subglottis, and these all changes bring about changes in the mucosa, submucosa, glandular tissue, leads to different production of secretions, hyperemia, edema occur, and then all these changes bring changes in the epithelium also, in which ciliated epithelium changes to squamous type, and this squamous epithelium cause hyperplasia and keratinization. So all these changes are the changes that ultimately lead to the hypertrophic type of laryngitis. Clinical features are the hoarseness, constant desire to clear the throat, dry cough, tiredness of voice, and discomfort in the throat. So all these are the common clinical features. You notice that they are present always whenever there is involvement of the larynx, because of the involvement of the vocal cords. The hoarseness of the voice is present, tiredness of the voice, usually there is dry cough, all these features are present. On examination, you will see their mucosa is dusky red and thickened, and there is vocal cords are red and swollen. Later on, the cords become bulky and irregular. Ventricular bands are red and swollen, and there is impaired motility of the vocal cords. So that's the presentation of the patient with the hypertrophic laryngitis. Treatment is usually conservative and surgical. Surgery is required because of the hypertrophy that is present. So surgically, that hypertrophy tissue needs to be managed, so the patient will have proper recovery of the voice. So that was all about the section 3. Thank you for watching sqadia.com.